Hello, this is Renee again. In this voiceover, we're going to be covering the auditory system and hearing impairments. In the auditory system, the ear provides essential data about hearing and balance to the brain. It works with the brain to interpret sounds. Loss of hearing and balance poses safety risks and socialization problems. Loss of hearing impacts communication, and difficulty communicating can lead to isolation and depression. Many aspects of daily life are affected by the ability to hear, and hearing loss not only affects health, but the overall quality of life. Gradual hearing loss that occurs with advancing age is known as presbycusis. So in terms of functional components, the ear consists of three major parts. The function of the external ear is to funnel sound waves. The middle ear has three functions: conducting sound waves from the outer ear to the inner ear, protecting the inner ear from loud sounds, and equalizing pressure from the middle ear. The inner ear is involved with hearing and balance. The cochlea in the inner ear contains the main hearing apparatus. Cranial nerve 8 contains the sensory cells of the inner ear and consists of the cochlear nerve, which carries information about hearing, and the vestibular nerve, which carries information about balance directly to the brain. There are several factors that place a person at high risk for developing hearing loss. The risk can increase with age, and it is hereditary, and it tends to run in families. If you are exposed to loud noises via your occupation or recreation, you are more likely to suffer hearing loss. Exposure to certain medications and illnesses can affect hearing as well, and so can congenital abnormalities. There are three categories of hearing loss. The first is conductive hearing loss. This is a physical obstruction of sound wave transmission that can result from otitis media, an external ear infection, foreign bodies, or excessive earwax. Sensorineural hearing loss is a deficit present in the cochlea, cranial nerve 8, or the brain. It involves interference of the transmission along the nerve pathways, and it can result from congenital defects, acquired conditions like infection, ototoxic medications, or exposure to constant noise. Sensory hearing loss is sometimes reversible, but neural hearing loss is permanent. The third type of hearing loss is a mixed conductive sensorineural hearing loss. This is a profound hearing loss that encompasses both conductive and sensorineural injuries. Hearing loss is usually gradual, so clinical manifestations of hearing loss usually appear over time, starting with maybe turning up the volume on a TV or frequently asking someone to repeat something. But then as it becomes more profound, the hearing loss can cause withdrawal from conversations and avoiding social situations because the person can't hear the conversation going on. Profound hearing loss can also disturb the quality of a person's own speech. You can see this most evidently in clients who have had profound hearing loss since birth. These people have trouble making correct pronunciation of words versus someone who loses their hearing later in life and maybe knows how to pronounce and enunciate the words correctly because they have actually heard them before, but now they can't. Assessment of the auditory system starts with a good detailed history. You want to find out about a patient's medical history, current medications, and if they had any past problems with hearing. If anyone in their family has had hearing problems, do they work in a loud environment? Do they smoke? Do they have allergies? All of these can really impact hearing. You also want to find out about their personal hygiene habits because some people like to use Q-tips way too much. You're actually not supposed to go digging around in the ear and cleaning out all of the wax, as it does serve a purpose, a protective purpose in the ear. By sticking the Q-tips in the ears, you can actually move the cerumen, the wax, and cause a blockage. Genetics can also play a role because more than 400 syndromes are linked to hearing loss. An auditory assessment will also include a physical inspection of the ear using an otoscope. You want to look at the tympanic membrane, the eardrum, to notice its color, if it's translucent, and its position. Hearing acuity is measured through audiometry, and this is usually performed by technicians and some nurses with specialized training. Tympanometry is performed to assess the mobility of the eardrum and structures of the middle ear. Because these changes are consistent with the presence of fluid in the ear, This test is helpful with distinguishing middle ear pathologic conditions such as otosclerosis and siccular disarticulation, otitis media, and perforation of the eardrum. There's also other more detailed tests that can be ordered if needed. The ear is a sensitive organ with many fragile parts. Several categories of medications can prove dangerous to the proper functioning of the ear, and these are called ototoxic medications. Patients are often not aware that medications can impact their hearing and do damage. Some of the most common ototoxic medications are antibiotics, gentamicin, erythromycin, and vancomycin in particular. Other categories include diuretics, NSAIDs, chemotherapeutic agents, and some miscellaneous medications such as quinine for treating malaria is also ototoxic. Usually the first sign of ototoxicity that the client will experience is ringing in the ears, also known as tinnitus. One of the most important components of a hearing assessment is educating the client about hearing protection. The delicate structures of the ear need to be protected from excessive noise. Documented injury can occur from sounds greater than 85 decibels, which is somewhere between a vacuum cleaner and a lawnmower. With all the cell phones and personal media devices and the constant use of headphones, this can damage the ears, and education really needs to focus on that listening at high volumes over long periods of time will lead to hearing loss. And again, we also need to educate on the use of cotton swabs or any other foreign objects to try to clean the ears out. So this slide is just going to review the age-related changes to the structure of the ear and how it can impact hearing. The most common hearing disorder is otitis media, which is an inflammation of the middle ear canal, commonly caused by bacteria, but it can also be caused by a viral infection, allergies, or enlarged adenoids. Otitis media is usually more seen in children because their eustachian tubes are shorter and more horizontal than those of adults. In otitis media, as the fluid builds up behind the eardrum, it leads to bacterial growth and infection and causes signs and symptoms such as earaches. You'll see pulling at the ears in young children, pain, and some other non-specific signs of infection, like feeling feverish or weak. Sometimes there'll also be crying or sleep disturbances or even vomiting. The presence of an upper respiratory infection, a history of seasonal allergies, and especially smoking in the household can predispose an adult or a child to otitis media. Otitis media can appear suddenly, or the clinical manifestations may develop over a period of a few days. Recurrent bouts of otitis media can lead to complications, including those that you see listed on the slide. Labyrinthitis is an inflammatory disorder of the inner ear labyrinth that occurs as a common complication of otitis media, which results in a disturbance in balance and hearing. Since most cases are bacterial in nature, otitis media is usually managed with antibiotics. Surgical management of recurrent otitis media involves laryngotomy, which is where a tiny slit is created in the eardrum to relieve pressure caused by fluid accumulation. Sometimes tubes are also inserted as well, and this is called a tympanostomy. Moving on to tinnitus, this is most commonly described as a noise or ringing in the ears, and it can be caused by age-related hearing loss, ear injuries, and other circulatory system disorders. There are two types of tinnitus: subjective, meaning that the patient is the only one that can hear the sounds, and objective, meaning that there are sounds that the practitioner can also hear. And these are usually sounds that are related to muscle contractions or blood vessel bruit or inner ear bone conduction disturbances. The clinical manifestations or sounds that are associated with tinnitus have been described as ringing, buzzing, roaring, clicking, whistling, or hissing sounds in the ear. These sounds can appear intermittently or be present consistently. Management is trying to determine the underlying cause of the tinnitus. An assessment would include looking for impacted earwax, otosclerosis, vascular problems, Meniere's disease, medications, noise exposure, and damage to cranial nerve 8. Also, the presence of tumors or a history of seizure disorders. Treatment for tinnitus is usually medications that aim at reducing the symptoms. They don't cure the condition, but they can help the patient cope with it. Vertigo is another clinical manifestation that usually results from an abnormality in semicircular canals or central nervous system structures that process signals from semicircular canals. Vertigo evokes the feeling of movement, but makes you feel like you are spinning at rest and that you're not balanced. And you can also experience lightheadedness or nausea and vomiting, and some people also have hearing loss. Treatment of vertigo is focusing on finding out the cause and remedying it. Useful medications for vertigo include meclizine, which has antihistamine and anticholinergic effects. Antiemetics are also commonly used to treat the nausea and vomiting that is associated with vertigo. Complications from vertigo usually result from injuries due to falls because of the impaired sense of balance. Continued vertigo can also lead to depression and anxiety. This is because the person will start restricting their activities because the more they move around, the more they just don't feel well. Moving on to Meniere's disease. This is an inner ear disorder that affects balance and hearing. It is the unfortunate trifecta of vertigo, tinnitus, and hearing loss. These patients also exhibit an excess of endolymphatic fluid in the inner ear canals, and this causes an obstruction of the inner canal system. It is known to occur most often with infections during periods of high stress, after traumatic injuries, and with allergies. Clinical manifestations can include vertigo, nausea and vomiting, sweating, an increase of symptoms with movement, unilateral and sometimes bilateral hearing loss, tinnitus, diarrhea, headaches, abdominal pain, and sometimes uncontrollable eye movement. Management for Meniere's disease is supportive. It aims at helping to alleviate as many of the symptoms for the patients as possible. There is no known cure for Meniere's disease. Some recommendations to help patients cope with Meniere's disease include a low sodium diet, avoiding sudden movements, avoiding bright lights, getting adequate sleep, acupuncture, regularly exercising, and limiting caffeine and alcohol intake. Okay, so this concludes the voiceover for the hearing impairments. If you guys have any questions on any of the sensory content, feel free to email me at any time.